Hello, everyone. My name is Mark Kageyama, and I'd like to welcome everyone here to Be Your Own Hero. I'm a stage 4 prostate, bone, and lung cancer patient slash survivor. Been dealing with cancer since late 2020, early 2021. Doing very well. Uh, we are now here, as you know, in Texas, and things are going very, very well. We have a lot of out-of-town guests coming in, and so we're doing a lot of entertaining with family. My granddaughter, 1-year-old granddaughter, is
Oh,
growing like crazy. She's about 17 months now and is running our lives, but it's all good. We babysit her 3 days a week, and she's starting to string together words. So she knows a lot of individual words, and I think she's going to be starting to talk soon. She runs all over the house, and we have to chase her. And that's how we get a lot of exercise, running all over the house because she gets into everything. And so always have to have at least two eyes on her at all times because she runs around into different rooms, and we look up and instantly she's gone. So uh, she keeps us on our toes, but it's all a very, very wonderful thing, and we're very blessed. And I am very happy today because I have somebody who is on a very, very similar cancer journey as me. And so I would like to introduce to you Allyson Lovina Phelan. Allyson, please introduce yourself and tell us a little bit about who you are, and we're going to get into a great conversation.
my name is Allyson Lovina. I'm a stage 3 colorectal cancer survivor thriver. I'm a mom of two wonderful teenagers, and I do a lot with the cancer community. I also have a YouTube channel, and I'm on Facebook, Instagram, TikTok, pretty much every platform except Twitter, maybe sometimes. I'm a cancer coach, so I coach people through their journey, and I do live meditations and workouts, cancer centric. I have a course called How to Get Through Cancer with a Smile, and I have a cancer support store for people that are going through their treatment and after. There's all kinds of things that will help you through your journey. And then I have a nonprofit called Random Acts of Cancer Support Kindness. So I'm
And
busy. I'm really
and
busy.
you
Oh, and I have
forgot to
3 dogs and
mention
yeah.
that you're from California and very close to where I used to live.
Well, I'm not from California. I'm from Vancouver, Canada, but I've been in California for a long time.
Right.
So
Yeah, that's where you live, and that's where I
that's where I
used to
live.
live.
Yes. Yeah.
So let's talk about the beginning of your journey uh, and see what you actually went through and how everything progressed to where it is today. How did it all start?
It was the summer of 2012, and my children were 4 and 6 at that time. I had some issues with my stomach. I couldn't eat a lot of the things like spicy things or coffee. It would always bother me. And I started losing weight just naturally. And I've been pretty thin my whole life, but I was getting super thin. And I remember one of my friends saying, "You're losing weight. You look so good." I'm like, "I know, isn't it amazing? I'm not doing anything." And now we joke about that. I'm like, not a good diet at all. Cancer diet is not a good diet. And then I had a little bit of bleeding, but I didn't think I didn't think much of it. Sometimes that happens, and I'm the kind of person like a super mom, like a superhuman. I'm like, nah, nothing's gonna happen to me. And so I just kind of like ignored it. And it was summer, super busy with little kids. So I was like, I'll go later. So I went and saw a doctor and she says, "Oh, you need to see a GI doctor." And I'm like, "Why?" "Well, we just need to check everything out." And I'm like, "Okay," but I didn't think it was like a big deal. The word cancer was not spoken. Like if she said, I mean, you probably don't have cancer, but maybe you got to check for this and this and this and put cancer in there, I probably would have been a lot more um worried. But I waited until like it was like October. I went to see the doctor. She said, "You need a colonoscopy." I'm like, "Oh, okay." Because I just turned 44. So I'm like, nobody was thinking about colonoscopies at that point. And I I booked the colonoscopy 3 times and I canceled 3 times. Then, no, that was 2011. Then in 2012, February, I had my colonoscopy on the 9th and February 9th, and that was a Wednesday. She called me she called me on Friday afternoon, and she said, "I am okay, I need to see you." And I'm like, "Okay, what's your schedule like?" And she said, "Well, I need to see you now." And I immediately knew that I had cancer. And I said to her, "Am I gonna die?" This is Friday afternoon in Los Angeles. Like, no doctor is going to ask you to go down to try to get to the office. Um, and what it was so ironic about it all is like my best friend and I were like huge Madonna fans before she like went a little bit crazy. But we would always go to the concerts. She'd call me, and I was with my friends. That after the colonoscopy of the day, you could it's like easy. You just go back into your life. It's not like a big deal. Um, she said, "Well, how did it go?" And I said to her, "Oh, it went fine. Don't worry. At least it's not cancer." I said that. And when she said, "You need to come to the office," my doctor, I'm like, "I've got cancer." I called her immediately. I'm like, "I've got cancer. I know I've got cancer." And I went there. I loved her. She put her hands on my knees and she told me that I had colorectal cancer. And I was like, colorectal cancer? Like what? Like I didn't know anybody who had that. I'm like, breast cancer would make sense or ovarian or something, but I was pretty shocked. And immediately you're taking your blood pressure, you're getting all this information. And the following week, I was taking a chemo pill at that time and doing radiation. And then that was the beginning of the journey.
So when he told you you had cancer, what went through your mind at that time?
Well, the first thing was like, am I going to die? Because I didn't know like where the cancer was, or how if it had spread or anything. And then after that, I'm like, I'm not going to die. I have 2 children, and when I went home, I am Catholic. I'm a practicing Catholic, and I just got down on my knees and I had a conversation with God to just stand by my side. I'm going to do all the work, just take care of the babies. I'm not leaving. I'm raising my babies and I'm going to make it. So that was my first thought. And from that point on, I took all my negative thoughts and threw them away. And I just went down a positive path. And even in the darkest moments, I would call on him and he was always there for me. So I was very blessed. And I had a huge um, support group of friends and the church and our priest. And so, to have people around you like that to lift you up. And sometimes I call it the chemo cave when you get stuck in the chemo cave and you don't want to do anything, you don't want to get up. My friends would text me because I wasn't texting to their text messages, texting back, and they're like, "Put your clothes on, we're taking you out." And they come over pick me up. We go to like Starbucks, have tea, and then I got out of my chemo, okay, because you get stuck with your disease. And I was also very lucky that my children were young, and I wanted to go to every event, and so I had to force myself, and I did it every single time. I mean, I had my little friend Percocet, which I'd never tried. That was interesting. I never took the whole thing, only after the surgery, but after that, I didn't need that much. But like when I first got back from my first surgery, my daughter as it was at her new school, my son was still in preschool, and they had this event at the end of the school where you like have a picnic, on the lawn part of the lawn field part of the school. And my daughter really wanted me to come. And I was like in so much pain. And so I said to my husband at the time, I'm like, okay, just get me a wheelchair. So we drove up, and every single bump when you're driving, that hurts. Like every single comment, like it was a lot. It's just like a lot. And they they rolled me onto the field, and it was more like a grassy knoll. It wasn't like a field. And so like I was still in my robe, right? And probably did not look very good at all. And everybody were like coming up to me. So my friends and I were joking. I was like the Godfather because I was just like sitting there. How are you? What like it was actually awesome. Like talk about random acts of kindness. Like people that I didn't even know, anything we can do, help you with your children. So that was a pretty crazy day, but I got up and I went out to like recitals, games,
Let
variety
me pause you
shows.
right there, Allison. You had two young kids.
Yes.
How did you share with them about your cancer journey?
Well, that's one of the things that I discuss with um, the patients that I'm working with that have children. It's really up to the parent. For me, because they were so young, and Sophia was in school from kindergarten to the eighth grade. If they hear the word cancer and maybe that one of the older kids had a friend or a parent or whatever died, I didn't want them to know that. So I said, Mommy has a bump and the bump is bad and the doctor's going to take it out. And that's it. And I faked everything. I faked like that I could get up. You're talking about how difficult it was to walk, like for me to get to the couch to the fridge. It's like a whole thing, it takes a lot of effort to do that. But because of them, I just like I made it happen because I didn't want them to think that anything was really wrong. They knew that I was not feeling well, but I wouldn't say the word sick. I kept it like trying to be the best mom that they knew before. And even though I wasn't able to take them to school to pick them up, I wasn't around as much. But when I was with them, when they come home from school, I'd still help them with their homework. And I had that quality time with them, and especially on the weekends. But for some
So,
parents, it's fine.
so when you talk to them now, how do they relate to what happened back then, as more as an adult? Because they're adults essentially.
They just thought that I had the flu. They didn't think it was anything big, even when they would come into the hospital. And my son, oh gosh, he wrote something about it. It was just lately because he's applying to universities or college, as you say here in America. And he was saying, my mom had cancer, but I never knew because she was always happy. And I never knew that she was in all of that pain, but she was always there for us. We went to the park, we did all of these things together. So I didn't even know that she had cancer. and she's always positive, and I've learned a lot from her.
That's
Something like that.
beautiful. That is beautiful. Um, that's something that I wanted to do was to be an example for my kids as well. And for them to have that memory of you at your worst is pretty special. It's really, really special. And the effort that you gave at that time is absolutely amazing. Absolutely amazing. And so that's uh, a really, really difficult thing to do. And I commend you tremendously for that.
I didn't want them to know that I had cancer. Just it was too big of a word for little kids. It's a big word for us. And my daughter also, she's like, I didn't know that you had my thing. She found out through somebody else later on, and then she basically had the same comment that Connor had made. So that for me was the best choice for my children.
So as they were growing older, how did that change at all, or you just kept it the same? Say if when they were uh, like 10 or 12, did that change at all?
You mean about them not knowing?
Yeah.
My daughter, there was a babysitter at her friend's house, and somehow the babysitter knew that I had cancer. They were about, I'd say 10 and 12. And she said, like your mom. And she's like, what do you mean, like my mom? So then she came over, she might, did you have cancer? I'm like, okay, yes, I had cancer, but I don't have it anymore. So it's okay. There wasn't I didn't, I wanted them to be like older for me to like talk about this. I didn't want them to worry about that because like, oh, like people say, oh, cancer can come back. Like, I didn't want to hear, I want them to hear that. So I tried to protect them as much. And I have a friend who had the same situation, and she tells her children everything about it. There, I mean, it's just a different approach.
Right, right. No, and it's fascinating to me when I do hear, different approaches. I talk to, in fact, most people that I know do tell their kids and tell them even if they're young.
Yeah.
So I mean, everybody's different, and I respect whatever people decide to do because a cancer journey is your own journey, and you need to make it you. And if you feel
Yeah.
comfortable doing that, by all means do it. But it's always good to keep the family close and throughout the journey. No, you had a I haven't heard honestly, I haven't heard anybody do what you do, which is pretty phenomenal. So, but
Oh, really? Like you mean with my kids, with
yeah,
my
no, yeah,
children?
yeah, I haven't heard that. So for you to be able to uh, go through it and just say you have the flu is pretty amazing. But let's move on. Let's move on in your journey. So what happens next?
Well, after radiation and the chemo pill, you get a little break. It was Radiation was really tough. Not in the beginning, but towards the end, and I was in so much pain because when for radiation, your skin usually burns off a lot of the time. So it was like extremely painful for me. And I was sitting on the bed, and I am not like a big crier unless it's like a really sad story or a movie. But I was like sitting there and I was like crying like really softly. And they're like, what? You're crying? And they're like, what's wrong? And I'm like, I'm in so much pain. And that's when Dr. Percocet came by. And then I took a break, and then I had this major surgery, like 10-hour surgery, which is not uncommon. And then I had a break, and then I went into infusion chemotherapy. This my second round, I got really, really, really sick. Like I thought I was gonna die, and I almost did die because I ended up having colitis, which is basically toxins within your bloodstream, which it comes from chemotherapy. It's called like um, it's not just from cancer to colitis is other can be caused by other things, but for me, the chemo was like killing me. It was too much. So I was in the hospital for like 5 days. I was on morphine. I told them to take me off of that because I was having terrible hallucinations. My friends came to see me, and I could tell, like, on the look on their face that I looked like I was dying. And I said to them, I'm not dying, guys. I know that I look like it, but I'm not going to die. Um, and I had to eat. I wasn't eating anything, and they weren't going to let me go until I would eat something. So I became friends with my doctor, who was like, and she's an intern. She goes a hospitalist, so she talks to your oncologist. She's the in between. We became like best friends. Like it's been 13 years. We've been best friends. And so she gave me her number, and I called her like on the. She said if you can eat this yogurt, then you can go home. I'm like, okay, okay. So I texted her. I'm like, can I have a Gatorade too? We have a joke about that. And so she said, yes, anything that you want to eat. So it took me like 4 hours to eat that yogurt. And then I went home. And the next day I was like back because I was not ready. So after that healed, I changed oncologists because the my first oncologist was very young, and I'm sure she's a great oncologist now, but I don't think that I don't know. I just felt like when I told her when I was in her office, like I'm so sick, she's like, we'll have to wait till tomorrow. Well, tomorrow couldn't wait. Like I was so in such pain. So I got a new oncologist, and he lowered my dosage, and I got on track. So it was much better. And yeah.
Let me ask you a big question. Okay. So you were in a position where you thought you were going to die. How were you able to reconcile your own mortality in that moment?
In what way?
I mean, you were faced with dying. What went through your mind, or that wasn't an option, or you were accepting of it? What?
No, it was not an option. I thought I felt like I was gonna die, but in my mind, I'm like, you're not gonna die. Like the conversation is no, 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 no. I'm like, my only goal was to live for my children. That was my only goal. And my doctor, he said, you're gonna be fine because of your goal. Like that's gonna keep you like you have to want to live for something. And there's no way. There's just like no way I'm leaving my children. No. Mm-mm.
I love that. Absolutely. I was exactly the same way. I had to live for my family. And I had too much that I had to do left on this earth. I still have too much
Yes,
left to do on
yes,
this earth. In fact,
yes.
there's even more, more now than at ever. But it's all good. It's all good. So what I'd like to do is ask you if you'd like to come back and we could do at least one more part of this interview. Would you like to do that?
Yes, I would love to do that.
Okay.
There's so much to talk about.
Yes, there is.
Like even what you're saying, like there's so many things that you want to do. This is why I call cancer a backwards blessing. It's because when you finish cancer, you're so grateful to do anything, to do anything. And so I would say like 99.9% are so much grateful for everything that they have and everything they have. And then you start doing the things that you wanted to do and you just, oh, I'll do it later. Like, oh no, no, you need to do this now. I never saw the
There is
Rolling
no later.
Stones. There
There
is no
is no
later.
later.
So the Rolling Stones, I'm like, I after that and like Prince had died and who else? Superstar. Michael died. I call my friends, I'm like, we have got to see the Rolling Stones. I've never seen them. And then Mick Jagger had a heart attack. Like, right, we bought the tickets, and then so they canceled that. Okay, he got better. He had like a heart, I think he had a heart attack. But anyways, he comes back, and SoFi is our new stadium here, Coliseum. It's like so beautiful, and that was like one of the first that I saw him in the SoFi for the first time, and right before that week, his drummer died. I said to my friends, like, what the heck? Like, we got to do everything that we want to do right now. So it was an amazing concert. By the way, he's like amazing, amazing, amazing. Like he is 21. But those are like things that you just like kind of you just like wave by before everything is much more clear. Like it's clear and you don't waste any more time because you understand how precious every single second is because you never know what's going to happen.
Absolutely.
Yeah.
Well said. In fact, that's one of the themes of this channel is, making the most out of every single day and every single
Yes.
minute, and so
Yes.
that's beautiful. Absolutely beautiful. You're a mind reader. You're jumping ahead of me.
Well, I said when we started talking, I'm like, oh, we're on the same journey. We have the same mindset. And like this is better for everybody to have a mindset like that for themselves
Absolutely.
and for the people that they love. So
Absolutely. No question. So why don't we're going to be wrapping up this particular first part of our interview. And I have a question for you that I ask most people. And the question is not related to anything that we've talked about. The question is how would you, if you had the power, how would you make the world a better place for everyone?
so one of my mantras is giving is the gift you give yourself. So I would do everything that I could give to make this world a better place. And of course, stop all diseases and all cruelty and poverty, all of the bad things. Like that's what I would use my power to make this world like God wanted it to be.
That's
Because it's a
beautiful.
beautiful place, but
Yes,
we have to get away the darkness. And we could actually,
I
we
agree.
can, and we will. So, yes.
Thank you so much. And we're going to bring you back to shoot a part two at least. And really appreciate your time and your input. And it's been a lot of fun, uh, hearing your story and hearing your journey. And we'll hear more about in depth about what you do as well in upcoming interview. So thank you so much. Allyson Lovina, it's been a pleasure and an honor. And
And
I'd like
thank you
to,
for having me. Thank you for having me.
absolutely. And I'd like to thank everyone out there as well for joining us at To Be Your Own Hero. Here's your commercial. Please like, subscribe, make a comment in the comment section, and also ring that notification bell so that you get this new videos every week. We shoot them every week. And post them every Monday, so look for them on every Monday. And I have posted a brand new video every single week since I started this channel back in early 2021. So there's a lot of videos if you want to look at videos, and I have people looking at videos all the time. So I just wanted to thank each and every one of you for doing that. And I want to thank you and stress, like we've talked about, time is precious. Time is our most precious commodity. And once it's gone, it's gone. So make the most out of each and every day because each and every day is an absolute gift. And to open your eyes to a new day, not everybody does. And at one point, we all are not going to be opening our eyes. So take it for what it is. It's precious. It is absolutely precious. And make the most out of each and every day, each and every hour, each and every minute, and each and every second. Have a beautiful week, and we will see you next week on To Be Your Own Hero. Thank you very much.